everyone. In this episode, we'll get to hear from the occupational therapist who is working with client A, who we just heard from in episode 1. This will provide more detailed insight into what occupational therapy is doing with this client to help her achieve her goals. Hope you enjoy.
Hello.
Hi, Corey. It's Michaela.
Hi, Michaela. How are you?
Good. How are you?
I'm doing fine.
Awesome. Glad to hear that. I appreciate you taking the time to chat with me today just for a few minutes.
No worries. No worries.
Alrighty. So we'll start with introductions.
Okay, perfect. My name is Corey Layton, and I am the Director of Rehabilitation at Insight Skill Center for Visual Rehabilitation. I have worked there for 22 years now.
All right, amazing. So, um, again, some of your clients I was able to get in touch with and ask a few questions. So I'd love your perspective as their treating therapist. So for our first client, would you mind letting me know how long have you been working with this first client?
Okay, and I'm looking that up because I have actually seen her so many times over the years as her vision has declined.
Okay, so you would say
I'm kind of
she,
looking. So
sorry.
I started seeing her in 2020.
Okay, so you would say she'd fall into that category of clients where maybe she stopped seeing you for a little bit and then has reached back out to restart sessions, basically.
Absolutely. So yes, the first time we saw her, we did um, many home visits. We did 8 home visits, and then I've seen her pretty much every year, once a year since then. And it's to address needs as her vision changes. And so initially, when we saw her, she just needed a magnifier and lighting. And as her vision has declined over the years, she's needed more and more tools. And so we actually got a reading machine for her and taught her how to use it in the last year, along with teaching her. She just recently purchased an iPad per our recommendation because she was struggling so much with using her computer, just because she was using Zoom Tech software, which, while really good, it also poses a lot of problems with navigation. It's
Mm-hmm.
a little glitchy. And so her ability to manage her finances, she also is really heavily involved with Weight Watchers. And so that's one of her hobbies is she compiles recipes. And so that was her goal with the iPad, and she met those goals this year actually. So she's using her iPad to read and compile those recipes.
Yeah, that's exciting. Um, and remind me, her diagnosis.
So she has, yes, macular degeneration, but she also has Best disease, which is, a form of it's very much like macular degeneration, but it presents itself at a much earlier age. So she's actually been struggling with vision loss, although it was very mild since um, her 20s, and so she's functioned very well, but over time it just gradually gets worse, and she's now, I believe she's in her late 70s, and so she's been dealing with this eye disease for 50 plus years. So
I remember when I asked her what her diagnosis was, she had mentioned it was some type of macular degeneration, but I remember thinking it was not a very common one that I had heard of before. So
yes.
definitely interested to look into that a little bit more. But um, as you've seen her over the years and each time she's reached back out to you, do you feel like she has been successful with the interventions that you are trying to implement um, in terms of, technology and her changing vision, all of that?
Absolutely, because sometimes when she reached out to us, it was for 2 years ago. Her goals were accessing her mail. Her son actually lives in the basement, and so he helps her a lot as needed. But he travels for his work, and he was going to have to be gone for a prolonged period of time. And in his absence, she had to be able to go through all the mail. and pay all of our bills independently. And I find that a lot with our clients that they're doing pretty well, but they have support from somebody else. It could be a spouse or a family member or a neighbor. And when that support goes away, either through travel, oftentimes it's the death of a spouse, we find that people reach out and say, I thought I was doing really well, but now I have to also take on this role. And so it does certainly impact their goals.
Yeah, absolutely. That being said, too, if there was one thing you could say to potential low vision clients about occupational therapy services and low vision, what would be the one thing you would want to say to advocate for OT services with this population?
So with low vision, I think it's important to connect with an occupational therapist as not only when you're first diagnosed, but as the disease, whatever that disease is, progresses, because most eye diseases are progressive diseases. The reason is twofold. Number one, it gives the patient hope. So when the patient is first diagnosed, oftentimes, they're told you have this eye disease. Most of the time, they tell them that there is nothing that can be done for this eye disease. In the case of macular degeneration, which is a big part of, or a big population that we see. And so it gives them no hope. And so what we find is that they tend to just give up everything. They give up, one of their roles. I might give up cooking to my husband. I might give up financial management to my husband. And then I'm not going to cook anymore. I'm not going to read anymore. So they give up all of these life roles. And we find out that this causes more depression. So it's kind of a cyclic pattern. Mm-hmm. And so if they can see the tools early on, and they can see that with a little adaptation, they can still manage most of these things. That it gives them hope for the future. And so I think it just changes their whole course of their disease when they have some hope about what's going to happen in the future. Because oftentimes we see people very late in their eye disease. They may have been diagnosed, 10 or 15 years ago, and they have not done these activities in so many years. It makes it much more difficult to do the activity again. And a prime example is most of our patients want to read again. Mm-hmm. They want to read for leisure again. And, over time, without reading, we lose our ability to decode words. We lose our reading speed, which makes reading not as fun. We lose our comprehension, and that impacts our short-term memory. And so it impacts a lot of areas of their life. And so the earlier somebody can be seen, the better. But I think because occupational therapists are multifaceted in our knowledge, we work with the whole person and not just the eyeball. We can kind of understand what's going on and help them through the rehab process and teach them about their prognosis. And that for most of our clients, they will not go completely blind. But if they do, there's still hope of living independently.
Mm-hmm. Yeah, absolutely. I think, you hit the nail on the head with occupational therapists having that niche of being able to address the whole person holistically versus, the symptom or what's right in front of us. I am excited hearing you touch on it. I know you've been in this field for a long time and have a lot of insight into this as well. So I'm excited getting to listen to you, and I'm excited that, I also get to use our conversation as a way to advocate for these services and hopefully, reach more clients and reach more potential clients that we can help. And so, yeah, I just appreciate
awesome.
your comments.